Okay, so this is the Provider Collaborative webinar for this month, and the topic is CCO disenrollment requests for continuity of care and changes to the provider CCO change request process. For agenda, we'll go over introductions in just a moment. We'll discuss requesting CCO disenrollment for continuity of care reasons. We'll talk about provider CCO change requests and that process, some changes that you will see around that process coming soon, and then some resources available to you. So let's go ahead and start with introductions. I'm Colette Bird. I'm the Provider Campaign Coordinator with the Community Partner Outreach Program at OHA.
And I'm Sabina Zorn with Client Services Unit and Client Enrollment Services with OHA.
Thank you. Real quick before we get started, we do have everyone on mute, but you can chat. You can type questions into your chat box, and if we're able to answer them, we will. And if not, we will respond individually after the webinar is over. So let's talk about CCO enrollment. Most OHP members, as you all generally know, are enrolled in a coordinated care organization. Some members can opt out of CCO enrollment without medical reasons, so they don't need to submit that continuity of care request. And those groups are American Indians or Alaska Natives, newly eligible OHP members who are in their third trimester of pregnancy. Many of you know CALM and CALM Plus members are always on fee-for-service. They're never enrolled into a CCO. Those with third-party liability or other major medical coverage, including employer-sponsored insurance, for example, are typically fee-for-service. And then are dual eligible, so folks who are Medicare, Medicaid enrolled members. So there are some exceptions. Okay, so let's talk about the process for requesting CCO disenrollment for continuity of care reasons. So if someone is receiving care that their CCO, or they believe their CCO is unable to provide for them, they can request a disenrollment from their CCO. However, we first ask that members contact their CCO to discuss the need with their member services department and their care coordination team. So members should explain that there is a need and that their needs are not being met, and the CCO typically will triage that call and determine what the next steps are. They want to meet the needs for members. The members should document the conversation that they're having with the CCO and include the name of the person they speak to. And often what we find is that the CCO is able to work with the member to ensure that whatever their medical needs are being met so that they can remain enrolled in that CCO and get the services that they need. If, however, the CCO is unable to coordinate the needed care for that member, they should contact OHP Client Services Unit, which is that CSU team that Sabina oversees. The member should explain to OHP Client Services that they've contacted their CCO and the CCO was unable to address their medical needs, and therefore they were asking to disenroll. The member should definitely be ready to provide the name of their provider, so their primary care provider, and just that background information about why they want to be disenrolled from their CCO. At this point, OHP Client Services Unit will then mail the member the OHP 416, which is the Request for Temporary Fee-for-Service Healthcare form. Anything you want to add to that?
The form is not a public form. It is something that you do have to contact CSU to have us restart the process by filling out the form with the member on the phone. And they basically need to just sign it and give a short description of their medical need, and then they take that form to their PCP or their doctor. And a lot of clients seem a little bit confused when they get that form, but we also give them an explanation of what they also need to do with it along with the form. And the main message here is they basically sign it in a small explanation and then take it to their doctor.
So as Sabina mentioned, this form is completed, and the primary care provider will help fill in that information that is not pre-filled by client services unit. And then the PCP, that primary care provider, should also sign a letter explaining the need for the member to stay, for reasons why the member cannot stay enrolled with their current CCO. And then they should also prepare medical records and any other supporting documentation to describe what that need is and why there is the need for them to remain on fee-for-service or open card. So here's a sample of what that form looks like, the 416 form, and that's the member request for temporary fee-for-service healthcare. So one thing we wanted to mention here is that if someone is requesting disenrollment from their CCO, the way it is currently set up, if that is approved, they will go on to fee-for-service for their medical and as well as their mental health. So they will be disenrolled from the mental health CCO portion as well. So just a side note there. The form will get updated to make that a little bit more clear in the future, but that is good background information for you all to know. So the next step is the primary care provider will submit the member request for temporary fee-for-service healthcare form and the necessary documentation. So this is submitted actually using the prior authorization function in the MMIS provider web portal. The PCP will also then fax in any relevant medical records and that statement explaining the medical need for CCO disenrollment. They want to use the EDMS cover sheet. We have a link on your screen to locate that if you're not familiar with that form. From there, OHA reviews that request. They do connect with the CCO to verify that they are not able to address the medical needs of that member. And then they provide a decision to the member within 30 days. If the request is urgent, if the member has pressing medical needs, the provider can contact the prior authorization line, and you have the phone numbers there up on the screen. Now, if approved, the member will be disenrolled from the CCO. Again, that's both the medical and mental health portion, within 1 to 2 weeks of the decision being made. And of course, if that's urgent and that's been communicated, we can do that, or that can be done in an expedited manner. If denied, the member may request a hearing to appeal the decision, and they would be contacting OHP customer support to make that request. So one thing that we do see a lot of is that members are requesting CCO disenrollment, often with the help of well-meaning providers or community partners from their CCO, when really what needs to take place is an address change. A lot of times folks will move from one CCO service area to another and think that they need to request disenrollment from that CCO in order to start seeing providers in their region, when really what they need to do is tell us that they've moved and report that address change so that we can, on the back end, disenroll them from their previous CCO and get them into a CCO that's in their service area. Now, we've outlined the process for disenrollment requests for medical reasons, for continuity of care, but we definitely want to point out that the process has not changed for American Indian or Alaska Native members, pregnant women, or for dual eligible Medicaid, Medicare members. These folks may continue to request disenrollment through the existing processes. Anything you want to add?
No, we are focusing on saying the medical and mental health, but you also can ask to disenroll from a DCO, from a dental provider, so I just want to make sure that that's heard as well.
Awesome. Thank you. So we'll take a moment here and review questions, so hang tight. Question from Amy, can assisters ever call CSU for the member to request the form if the consent form is signed?
We're still sending the member the form so that they can sign it, or I guess we could send it to, let me think about that, sorry. The only way that you can sign on behalf of a member would be if you are an authorized rep. So we would still, you can call and fill that out on behalf of the member, but we still need to send it to the member themselves. That is the process. So you can start that initial part in us sending it to them and just, you know, working with them and understanding you fill this out and then get it to your provider, or you can step in and assist once they've received the form.
Great. Question from Jean. So if they disenroll in their CCO, they no longer have mental health care. That's not the case, Jean. It's just that they would be disenrolled from the CCO for the mental health portion, so they would be fee for service for mental health as well. So question from Myra, can we request disenrollment for college students? Sometimes they seek services with their college town, but their PCP is in their hometown. Yes, if there is a medical need, Myra.
Yes, otherwise they need to work with their current CCO, explain that they are a college student, and oftentimes you will find the CCO will help coordinate their care in the area that they're in or give them the options. Sometimes if they are a long way from their primary care CCO, they do ask or request them for their medical needs to be met in their main CCO. But if there is a medical need, that can be submitted for fee for service, but that, you know, documentation has to support that.
Great. Question from Griselda, would it be easier to have a client submit an address change in order to change the CCO, or is it convenient to just have the client call the CCO to have it changed? So Griselda, we would want to update the member's address within our system. So they would want to report that address change to OHA. So they can do that either by calling, or the assister can help them report that change through our existing processes.
And then overnight that gets updated to the CCO.
Okay, great. Thank you, guys. We're going to go ahead and continue. We'll have another opportunity for questions as well. So moving on to our next topic, let's talk about the provider CCO change request process. So we're shifting gears a little bit. This doesn't have to do with medical need. As of April 1, 2017, Provider Services Unit is no longer processing the provider CCO change request form. That body of work is now managed by Sabina's team, OHA Client Enrollment Services. And it's important to note that this process is available only to OHP primary care providers who would like to help their patients change from one CCO to another in the same service area. And this is really for newly enrolled, newly eligible members. I know we're going to get a lot of questions on this one, so let's hang tight and we will walk through the process first. So the purpose of the provider CCO change request form, which we'll look at in a moment, is to provide CCOs with a consistent process for requesting member CCO changes when again, newly enrolled member has been enrolled into a CCO that does not contract with the provider they're seeing. This allows the member to continue seeing that provider with that CCO change. It offers an approved and consistent form to be used across CCO providers and offers a point of contact for submitting those member CCO change requests. And we definitely want to point out that while this is one option for primary care providers, it is not the only way that a member can request to change their CCO. So this process starts with that newly enrolled member indicating that they want to change a CCO to continue with the provider that they've been seeing. So they want to express that to their primary care provider. The provider then would obtain the member's authorization. We'll again show you the form in just a moment. They'll sign the form. The provider completes all the required fields, and then they send that by email only to the CCO.change-request email inbox. Those signed forms should be scanned and attached. So here's what that form looks like. We've put a little red line through the fax option, and that is because, again, the provider services unit is no longer managing this body of work, and so that fax line is not really available anymore for this process specifically. So these forms can be emailed directly to that CCO.change request at state.or.us. So one thing is just making sure all of these fields are filled out. We do need all of the fields to be completed. So you'll want to double check that with the member. Make sure that it's legible. That's another piece, is sometimes the forms are handwritten and are not easy to read. So just double checking if you are assisting members with this process to ensure it's all legible before submitting. So the request is reviewed, and if it's approved, the plan is changed per the rule up on the screen. And that change is effective if made on or before a Wednesday. The date of enrollment would be the following Monday. If the request is approved after Wednesday of that week, the date of enrollment would be 1 week from the following Monday. Then OHA will contact the member and let them know of the change and the effective date. So we showed you that the fax line that's on that current form is no longer being used. So some changes coming to that form will be to remove that fax line and then also update the form so that the correct name of the team processing these requests will be displayed there. So some common errors. This form also is often used when what really needs to take place is an address change. So a lot of times we'll see that the member wants to change from a CCO in one region to a CCO in another region because they've moved, when really what they need to do again is submit an address change instead, and that would automatically trigger the disenrollment from the previous CCO and an enrollment into the CCO in their service area. If there's more than one option at that point, of course, they can include that with their address change. They can let us know that they have a preference. But otherwise, that would correct the issue if they were just trying to get out of the CCO that was in their previous service area. It's also a form that we find is submitted when really what needs to be requested is a disenrollment from a CCO for various reasons. And then that there's also often missing information like the member's signature, the provider's name and phone number, and if the member is under 19, the parent or guardian signature is often missing. So it's just really important to know that they can't be processed without all of that information. So if you find yourself helping your patients with this process, to know all fields do need to be completed. I know many of you on the webinar are provider assisters, but if you are a provider who is not a certified application assister and the request is urgent, you can, when you email that in, indicate in the email that it is an urgent request. For certified application assisters, there are other options as well. You can submit the request on behalf of a member to change their CCO as long as you keep a signed copy of the request that's signed by the member. And those changes can be requested through the One Applicant portal. You could email the community partner team at the OHP customer support. And these steps are also outlined in our client advocacy guide that is on group site. And of course, we have our urgent request team available for community partners as well. And you can reach out if there is an urgent need to change CCOs or any other urgent need for a change or update as well. So members can also, of course, make these requests to change CCOs just by calling the OHP Client Services Unit. Some of our provider assisters have recently noted that the menu, when you call that number, basically takes you to the same menu as the OHP call center does currently. So there are options. If that's what the member wants to do, they should just follow the options for updating their information, and it will take them to a menu that allows them to request a CCO change, which would connect them to Client Services Unit.
Yeah, so they're mainly listening for what says Client Services. And once they hear that, they can push the button. And generally, our wait times are much, much lower than our questions line, our application line, which is sometimes just a few seconds to a few minutes.
And then, of course, members can submit a request to change a CCO through their One Applicant portal. If they have created their own account, they can manage those requests on their own. Okay, so let's go to the question section. Hang tight. So Henry, it looks like you have a question that says this disrupts their discharge. Please speak to this topic. Could you provide a little bit more context as to what you mean, maybe which process you're referring to? And as you type, we will move on to the next question. Is this very strictly for new members? For example, some clients do not renew timely, are closed, and then reopen. Sometimes are auto-enrolled into the wrong CCO. Could this form be used in that case?
It's not the intent of the form, so we do generally deny those because we will look to see that they had previous enrollment or what we would call kind of recent enrollment. So it's not the intent. If we aren't busy, sometimes we do go ahead and help coordinate that, but for the most part, they are denied. I'm sorry.
And Amy, typically, if a member has been enrolled in a CCO recently and then there's a short gap in coverage, they should be put back into the same CCO. So if you're finding that that's not the case, do let us know, and we could probably take a look at those examples individually. So Anna, it looks like you were asking how long does it take for someone to be enrolled into the new CCO once they have reported the new address. So it really has more to do with when that address change gets processed. And then from the time that the address change gets processed, it's usually within 1 to 2 weeks.
Yeah, it depends on the enrollment cycle. So if it's on the Wednesday or before, that enrollment cycle would be next weekly, or if it's after Wednesday, then it would be the following Monday.
So Henry, thanks for clarifying your question. We'll work together and respond to you directly about your question that's coming in. I think that one might take a little bit further explanation. Jose's question, when someone goes on temporary fee-for-service coverage, how long are they on that coverage? Is it decided with all the chart notes submitted with the request, or is it a general time frame?
So that would be up to the provider to request. It can be a month, 2 months, 6 months, a year. So we do ask that the provider request that in their chart notes. Otherwise, we typically do a 6-month disenrollment for the CCO.
So Tiffany's question, is there a different process for members to enroll or disenroll with a dental CCO?
It's the same process.
Yeah, so thanks, Tiffany, great question.
Yeah, and just a little bit more clarity on that. A lot of people think, or a lot of members think they need to actually see their PCP for that, and it would be going to their dental provider.
Okay.
So that dental provider just needs to provide that same, discussion of what their medical need is moving forward. It's not their PCP deciding that. It's the information from the dental provider.
Great. Okay. Any other questions? All right, while we let y'all think about questions there for a moment, just want to review some resources that are available to you. As always, those medical assistant program general rules are available. Those are public, so you're always able to review the different rules that affect our processes and policies. We also have a link to OHP tools for providers, so lots of good information for providers. OHP forms is a great link if you want to look up these different forms that we've been referring to. The 416 is not on that server, and that does need to be requested through, as we mentioned, Client Services Unit. But most of our other forms are available on that server. Provider Services Unit, phone number and email address up on the screen. Provider training. This email inbox is for providers to email if there are requests or questions around provider training that are coming from OHA. And then Client Services Unit number is up on the screen as well, and that is available for members. So they should always have their assister ID ready if they're going to be calling clients. I'm sorry, not their assister ID, their prime number. Assisters would want to have their assister ID, but members would want to have their prime number ready when calling Client Services Unit. Okay, so I'm not seeing any other questions coming in. We will hang tight here for just a moment. You can always email me. I did send the slides to everyone who had registered, so you should have my email address if you have any questions after the fact. Thank you guys so much for participating today, and thank you, Sabina, for bringing your expertise to the table. Do have a great rest of your day and stay cool out there. Thank you all.